Good evening and welcome. I'm James Liu and I'm a librarian at Stanford Health Library. Thank you for joining us. Our talk tonight is entitled Understanding and Navigating Your Medicare Coverage in 2024. It is my pleasure to introduce our speaker, Maha Justi. Maha is volunteer HICAP Medicare counselor and is certified by the California Department of Aging. Maha has been assisting Medicare beneficiaries for the past 15 years with all their Medicare questions. She is a retired Silicon Valley engineer who enjoys helping seniors and their families navigate complex Medicare issues. Throughout the talk, please enter any questions in the Q&A box at the bottom of your screen. At the end of the talk, Maha will answer as many of those as well as the pre-submitted questions as possible. Maha, I'll turn it over to you.
So greeting everyone. Thank you for joining us for another Medicare webinar. I have done two in the past with the Stanford Library. So you might want to refer to Medicare 101 and annual enrollment period for some more background. So let's get started in the beginning. Who we are, who is HICAP. HICAP is Health Insurance Counseling and Advocacy Program. We are part of a larger countrywide program. We are mostly volunteer programs. We do have some permanent employees, very limited in every county. And the program is administered by the Department of Aging. We are all certified. We provide Medicare education and one-on-one counseling. There is a HICAP office in California in every county. I personally represent the HICAP San Mateo team, but the information I'll be presenting tonight is pretty generic. It's the same for every county for most of it. Our service is free, is unbiased. We're not associated with any health insurance providers. And it's, of course, very confidential. So today's agenda, I'm going to start out by giving an overview about Medicare, so people can understand really what they have and what is this all terminology is all about. It could be very confusing, and I hope in that section you'll be able to understand what is Medicare is all about. I will follow up with Medicare in 2024, what is new this year, and understanding your benefit and how you get more transparency of getting more information and additional resources. So let's start in the beginning. There's something called original Medicare. Original Medicare, when somebody turns 65, you have the right, if you worked in the US for 40 quarters, which is 10 years, you have the right to join Medicare at 65. Not to be confused with Social Security, which starts at 62 if you choose. Now, Medicare, original Medicare, the term original is very important. It has two parts, Part A and Part B. The program is, enrollment in the program is managed by the Social Security Administration. That's all they do, just to get enrolled. However, the program itself, the rules, the claims, everything that has to do with the details of Medicare is managed by another agency. It's called the Center for Medicare and Medicaid Services, CMS. Both of these agencies are federal agencies. Medicare fundamentally is a program which is a fee for service. Part A is, think of it as hospital insurance, but it's really more any facilities where you're inpatient, then it's managed by Part A, as opposed to Part B, which is medical insurance. If you go to a doctor, if you're an outpatient in a facility, that's Part B. Anytime we talk about any kind of insurance, we talk about the premium you have to pay every month, the deductible that you have to fulfill in order to get services that is paid for. And once that then you have the copay or the co-insurance. So just very briefly, Part A, if you worked in the US, for most people who have pay their FICA tax, then their premium for Part A is 0. However, the deductible is a number that is decided on every year, slightly changed every year. So this year for 2024 is $1,632 per benefit period. What does that mean, benefit period? Speaking of benefit period, it's like 60 days, basically. So if you go to a hospital, you haven't met your deductible, and they say, well, you have to pay your deductible first, which is $1,632. You leave the hospital, you're out of the hospital for 60 days. You come back on day 61, they say your benefit period expired. So you have to pay that deductible again. Obviously, that could roll multiple times during the year. That could be pretty expensive. However, the copay for the first 60 days in the hospital is 0. Part B, which is the medical physician type coverage, premium this year is $174.70 for most people. The reason I say it's for most people is if your income is above a certain threshold, then there is a surcharge. And the threshold for an individual is around $100,000, $103,000 per year. And for a couple, it's roughly $200,000. Above that, then you end up paying more for your monthly premium. As far as the deductible, it's once per year, it's $240. Now, once you have met that deductible, then Medicare works on an 80-20. So you go to a doctor, your Medicare will pay 20% of something called assigned bill. This is not the bill that the doctor comes up with, it's the bill that the Medicare and the doctor negotiated. And you're responsible for the 20%. Now you look at this picture and you think you have insurance, but the insurance has plenty of gaps. Everything in red could be pretty substantial over the year. So for most people, when they look at Medicare A and B, they decide this is not really enough coverage. They need something to supplement it. The first part that supplement, it's called Medigap. Medigap is insurance that you buy from a private company. Its only purpose in life is to close the gaps of A and B. So it pays some or all of what A and B does not pay. In 2024, the highest plans, it's called Plan G. And with that, you pretty much have almost everything covered that is not covered by A and B. The lowest plan is A. What's very important to understand about Medigap is there are certain triggering events that guarantees you enrollment. So you cannot just go to a Medigap company and say, I want to buy Medigap. It has to be triggered by certain event. One important event is when you turn 65 and you enroll in Medicare A and B, the date of B triggers Medigap, and you have a period of 8 months to sign up. If you don't sign up, then you have no guaranteed right. And if you come back a year later and say, gee, I really want Part B, then it's up to that private company whether they want to take you or not, or they might subject you to a medical underwriting. So it's very important to understand. What do these Medigap look like? Well, there are the benefits or the gaps that you're trying to close, and these are the plans that these private company might sell you. So if you look at G, you find that G, almost everything is checked except as $240 annual deductible. In the olden days, if you have Medicare before 2020, there was something called F. This is no longer existing. It's grandfather if you were eligible before 2020. But the best you can get today is G, and the lowest you can get is A. Very important to know also that you can always, once you decide on a high plan, you could always go down in benefit, but you cannot start in A and go up. This is a limitation, so that you need to understand at the time you're signing up. Okay, so you look at that and you say, okay, now I can supplement A and B with this Medigap. What else do I need to complete this picture? What's missing is a prescription drug plan. A prescription drug plan is, again, sold by a private company, and it basically covers all the medication you would take at home. Medication that you take at a hospital would be covered by A. Medication that you take at a facility, like a doctor injection and so on, that is covered by B. So anything that you can take yourself at home is covered by Part D. So that basically the core of Medicare. It's you could think of it as a public-private kind of a system. Now there's something called Medicare Advantage. So let's talk about that, what that is. So some people have this. Medicare Advantage is basically a completely private plan. So what basically happens is private companies came to the original Medicare agency and says, hey, we can offer these private plans and we can do a very good job and save you money. So let's go into detail a little bit of how these plans work, Medicare Advantage. And one thing to mention, that Medicare Advantage is nothing but a marketing name. There is no advantage or disadvantages. It's really a question of, does it fit your lifestyle or budget or not? So don't be sort of biased by this word Medicare Advantage. They are all-in-one plan. They're supposed to give you the services for everything that the original Medicare would have given you, but also include the drug portion of it. So basically what happened, your original Medicare is converted to a private contract. So the government agency basically says to these Medicare Advantage, Mr. Smith is your patient now, and you take care of them and offer them all the services within the Medicare rules. So they have to offer all hospital services, doctor services, and medical services. An example of a Medicare Advantage program is, for example, Kaiser. That's a Medicare Advantage. AARP United Healthcare. And what sometimes is confusing people is United Healthcare has a Medicare Advantage plan, but they also offer a Medicare supplement, and they offer a Part D plan. So when somebody comes to us and says, I have ARP, we have no idea what they're talking about. Is it Medicare Advantage? Is it a Medigap? So terminology is very important. Alignment is another plan. For example, this is a Sutter Medicare Advantage plan. So what do these plans look like? Well, in every county, and this becomes county specific, the HICAP office would aggregate all the plans from these private companies that are available in the county and have a list like this. So for example, the list would say Kaiser is offered in San Mateo County, and Kaiser would charge $70. And here's the name of the plan. This is the premium. And this is the out-of-pocket maximum. And every service has a copay. This is United Healthcare, ARP, and so on. And this sheet could be quite long because it lists all the copays for all the services. They typically don't have a deductible, but they could if they choose. They're completely private. The main thing is they have to cover the services that Medicare say they should be covered. So to try to compare the two, so here's one side is original Medicare plus a Medigap and a Part D versus a Medicare Advantage. In this case here, an original Medicare, it's a fee for service. There is no concept of network. If there's a doctor that has a contract with Medicare, then you can go to that provider, provided they have accepting new patients. And it could be anywhere in the country. So you could literally decide, I wanted to go to the Mayo Clinic. Then you could, there is no network in this site. There's no referral required in most cases. Sometimes it's helpful to have a referral, but it's not required. And it's supplemented, by Medigap. Medigap will pay, if Medicare, original Medicare pay, then Medigap will absolutely pay. If Medicare Original does not pay, Medigap would not pay. So basically, you never really get to talk to these Medigap people. They just go hand in hand with the original Medicare. Now, on the Advantage side, Medicare Advantage side, typically they're HMO or PPO. Certainly that's the case in our county. So there is a very strong concept of network. And referral is always required. There's a strong concept of having a primary care physician who refers you to another specialist within the network. You're always guaranteed to be enrolled if you decide, if you were on this side and you want to come here or you want to switch between plans, you always guarantee enrollment without any pre-existing condition, as opposed to a Medigap, which the guarantee is limited to a specific events. Okay, so let's do a quick example so that we can drive the concept a little clear. A 75-year-old who's in San Mateo County wanted to buy either a Medigap, an original Medicare with a Medigap G, or a Medicare Advantage. So try to look at the cost-benefit part of it. Well, in both cases, if that person worked in the US for 10 years, then the Part A premium is $0. The premium for Part B is exactly the same. Some people think if they go to the Advantage plans, they don't have to pay Part B, but they do have to pay Part B. They still pay it to Social Security, and Social Security turns around and gives it to Kaiser or United Healthcare, but it's still paid. So in this case, it's basically the same. Now, if you, in this side, you buy a Medigap G, for that age group, the cheapest you can find in our county is somewhere around $168 per month. Now, in the Medicare Advantage side, there are plans which are zero, quite a number of them actually, so there is no extra premium here. The deductible, in this case, you have $240 per year, which comes out to $20 a month. In this case, there is typically no deductible. Now here's where the difference comes really clear. Once you buy this stack here, you have $0 out of pocket if you have a Plan G. Then you're done. So basically you're paying the $168 plus 20, so let's say under $200 on this side, plus your B plan, and you don't see any bills for the rest of the year. On this case, your out-of-pocket maximum, because every service has a copay, it could be less than $300 a year or up to $8,000. This is what's regulated by Medicare, the maximum they can charge. Typically, they're around $4,000. So that really comes when somebody say Medicare Advantage is cheaper. Well, the answer is not so clear-cut. If you're extremely healthy, you never go to a doctor, and this part disappears because you never go to a doctor, you never have any prescription drugs, then that's all you paid, $174.70. So in this case, if you're healthy, you still have to pay your Part G premium. Now, if you get really sick, then this is not going to change. This is going to be the same. This case, this is your out-of-pocket maximum. So you divide that by 12, and it could be higher than this. So we warn people not to really look at the difference, not just on the face numbers and think this is cheaper or this is more expensive. As far as the medication, we have plans in San Mateo counties that are 40 cents a month. Here, there's normally $0 because they're part of this premium, but the copay for both are the same. So this is the maximum you're going to pay for the year. Okay, so very important then from this part of the presentation to really understand what you have or what you might want. Do you want to be on this side with the original Medicare and a supplement, or you want to be in a Medicare Advantage plan? For different people, there are different priorities, and there's not good or bad. It's really what fits your lifestyle and budget. And what's important to also note that if you decide that you're going to be on this side and you stay on this side for more than 12 months, you could always go back to A and B. What you cannot do is you're not guaranteed enrollment to Medigap unless you have a triggering event. And those are very special and far between. So we tell people upfront, please be careful and make a conscious choice upfront, whether you be on this side or on this side. Okay, so now you have your Medicare, you decided which side you're going to be. How are you paying for it? Well, if you're collecting Social Security knows about you, so they will automatically take the Part B premium. They have to take it out of your Social Security check. There is no option. They will deduct it automatically. Your Part D premium, if you happen to be on the side of the original Medicare, you could ask Social Security, I'd like that to be paid out of my Social Security as well. You can also ask Social Security to take your Medicare Advantage out of your Social Security if you want. What you cannot do if you decide to go to a Medigap, Social Security does not take that from your Social Security check. You have to pay that provider yourself. Now, if you're not collecting Social Security, you have to pay everything to the provider. If the provider is Medicare for Part B, you have to pay them quarterly. If the provider is Medigap or Part D or Medicare Advantage, you have to pay them yourself. Okay, so important dates. People always think of open enrollment, but there are other very important Medicare dates throughout the entire year. So right now is January to March 31st. It's a double deadline coming up. And during that deadline is, in this case, it's called general enrollment period. If you, for some reason, forgot to sign up for Medicare, just forgotten, then this is your chance to sign up. And once you sign up, it will, for A and B, it will become effective the month after you sign up. In the case of the other period, it's an enrollment for Medicare Advantage. So let's say at the end of last year, you signed up for Medicare Advantage. It came January 1st. You said, oh my God, this is terrible. My doctor is not covered and I need to go to another Advantage plan. This is your chance to switch plans. You can do one switch between January and March 31st. At the end of the year, toward the end of the year, if you have already Medicare, there is called something called open enrollment. This is to plan for the following year. What do you want in 2025, for example? And open enrollment is always October 15th to December 7th. And at that time, you reevaluate to make sure, do I have the right Part D? Do I like my Medicare Advantage? And so on. What people forget about is something very special in California, and it's called the California birthday rule. And this is a provision that if you have a Medigap plan and every year, starting with your birthday and 60 days after, you can shop around for another Medigap plan. Now, Medigap market in California is very competitive. And it's worth saying that if you decide for Medicare plan, Medigap plan G or A or whichever plan, the coverage is exactly the same between the companies. So it's worth shopping around. All the private plans are really designed for shopping around. They count on the fact that you sign up and forget about it. And guaranteed, if you sign up and forget about it, you're always paying more. Last but not least is something called special enrollment. And this is something triggered by event. For example, you were working, and if you are employed and you have a health insurance plan with your employer, you don't have to sign up for Medicare. You're exempt from signing automatically, exempt from signing for Medicare. However, once you stop working, you want to get on Medicare, then you get a special enrollment period. This is a time where you can enroll. And that period, depending on the triggering effect, could be 63 days or 8 months, depending on what trigger the event. So that can happen anytime throughout the year. Some of the questions that came through the pre-registration that I was not planning to cover had to do with employer plans, retirement plans. So I added this one foil at the last minute to answer some of the questions. So employer plans are private plans that are given by your employer as a benefit. So they come in actually mainly two varieties, but there is a third variety that I'll also mention. So one variety, for example, your employer could say, okay, go off and sign for A and B, and we become your supplement. We become your Medigap and Part D. That would be the employer plan. So the employer actually goes out and contract with an insurance company to offer the supplement for their employees. So this is one version of getting Medicare through your retirement plan. Your retirement plan could also decide to give you a Medicare Advantage plan. Again, they go out to Kaiser, they go out to United Healthcare, and they say, please design a plan for our employees. And this is what it would look like, will be through the plan. Both of them are employee plan, their retirement plan, and the rules are still the same as far as Medicare A and B is still existing. In the past, those plans used to be extremely generous and also cost effective, or actually they were cheaper. The trend is not so anymore. The trend is that they tend to be more expensive. So sitting here, I cannot tell you, is it better to have just plain Medicare and Medigap or your employer plan? You literally have to sit and look at all side by side and decide which makes more sense for you. With the understanding that if you decide to go with an employer type plan, regardless which side, you will lose your Medigap guarantee if you decide, look, after 10 years, my employer plan is getting really not so exciting, so I want to get out and go back to A and B. That's okay, but you don't have a Medigap, a straight Medigap guarantee, and that's kind of the key thing to understand upfront. So it's worth comparing. There are some questions. I tried to answer some of those questions, and specifically about the retirement plans, and the other one that came up again and again in your pre-registration question is about what if I'm working. And again, if you're working, you don't have to take Medicare. You can continue with your employer plan. And the only thing to be aware of, once you stop, you go to Social Security. Let's say you're 70 years old, you go to Social Security and say, now I finished working, I want to go to Medicare. They will say, where have you been since you're 65? You said, oh, I was working. They say, okay, take this piece of paper, go to your employer and have them certify that you were covered under an active employer plan. And if that's the case, then you enroll without any penalties. That's one thing to be aware of. The other thing to be aware of is that if you are working and collecting Social Security, Social Security knows about you, so they might enroll you automatically in A and B. So if you don't want that, you consciously have to call Social Security and cancel the enrollment. But other than that, you don't really have to do anything else. So this is a good stopping point to answer some questions from the chat.
One of the questions is the premium for Part B, the $174.70. Is that a monthly premium?
Yes, that's a monthly premium.
Okay, great. And then another question is this gentleman, he said his wife has coverage through his wife because his wife is still working. So he's only enrolled in Plan A, but not Plan B. His question is, when his wife does not have coverage in the summer, can he enroll in the summer for Plan B only?
Right. So if you're employed or your spouse is employed, either one, if you're under an active employment plan, then you're exempt from being covered with Medicare. And once which one is stops working, both of you or one of you can go to Medicare and say, okay, my coverage ended. Now I want Medicare. That's absolutely no problem. Okay, so let's quickly go through what is new in 2024. So through the Inflation Reduction Act, which started in 2023, insulin copay will be capped at $35 per month for Medicare recipients. One thing to make sure you get your insulin through your drug plan. So the insulin you're taking should be on the formulary of that plan. So you cannot just say any insulin would be covered. It's the insulin that's covered through your plan would be capped at $35 per month. All vaccines copay are now $0. Some vaccines are covered through Part B, and some vaccines are covered under Part D, the drug plan. Regardless, the copay is $0. There was in the past, if you had forgotten to sign up for Medicare, you had a waiting period after signing for like 3 months or so. Waiting periods had been eliminated. So once you sign up, regardless when you sign up for Medicare, the next month your benefit would be effective. What also happened in 2024, something very important, is that there was something called catastrophic coverage in Part D that would say that once you reach that phase of your coverage, you had to pay 5% of the medication cost. And that could be pretty expensive. 5% of an expensive medication could be very expensive. That has been eliminated in 2024. So now your copay is $0 once you get to the catastrophic coverage. There also for some lower income programs, they had asset limits that were pretty strict. So the asset limits for some of these programs have been eliminated. So regardless how much money you have in your bank, it used to be something like if you had $2,000 in your bank account, you would not qualify for this saving program, even though your income was low. That has been eliminated. 2025, what we can look forward to is medication out of cost will be capped at $2,000. So that's substantial that's going to be great benefit for many people that have expensive medications. Okay, so let's understand the basic Medicare. Now you have Medicare for medical and for prescription drugs in 2024. How do you navigate that? So let's start out by what are the different parts of this coverage, medical coverage first. There's preventive coverage. There is medically necessary coverage that you need throughout the year. There's emergency coverage, and this what I call extras. Well, preventive, regardless if you have original Medicare or Medicare Advantage, doesn't really matter. It's the same preventive benefits that are mandated by Medicare. Those preventive benefits are not subject to any deductible or copay. You should be able to get them without having met your deductible. They include things like welcome to Medicare when you first become Medicare eligible, and an annual visit with your primary care physician. This is something that is preventive, and it is covered by Medicare every 12 months. Now, medically necessary basically exactly what it says. Any coverage has to be medically necessary. It cannot be cosmetic or extra kind of thing, and it is subject to Medicare rule. And Medicare rule basically said it needs to be medically necessary. If you come across something that was denied, there must be an appeal process that tells you why it was not being covered. In addition, your provider, whatever provider, have to give you in writing a document, advance beneficiary notice, that would tells you, we think Medicare may not cover this service. Do you still want it? So, and you get to choose ahead of time. So you should never be surprised afterward that something happens, that they should give you that in advance. Emergency. So emergency is covered. Basically, you go to the nearest medical facility, regardless of network. So if you happen to be in New York and you have a Medicare Advantage plan, and you have an emergency, they have to treat you with in-network copay, as if you were at your home network. There is a surprise billing is illegal. It used to be a case where sometimes you would have you would go to a doctor or an emergency room, and you get a bill from an anesthesiologist that says he's not in the network. Well, that's no longer your problem. You say, well, that's too bad. I walked into the facility. It's an emergency. Everything should be in network. You're not supposed to get any bills from that, surprise bills. It doesn't mean they don't try. They certainly try, but you need to know your rights, that you don't need to pay that, and you can challenge it. Extras. So because of this public-private scenarios or completely private Medicare, it tends to be competitive. There is marketing involved. So these private companies offer some extras. And so, example, they could offer you vision benefits, hearing benefits, over-the-counter medication dollars. Will give you $100 per whatever, per quarter or so, to go get over-the-counter. Healthcare, health club memberships. So these are not Medicare, original Medicare benefit. These are benefits from your private insurer. They can change them anytime. They could take him, put him 1 year, take him away the next year. One thing to say, however, when we talk about visions, there are things that are covered under Medicare. For example, glaucoma, cataract. These are things that are covered under the Medicare. So these are not considered to be extras. Extras is if you need glasses or medical exam, vision exam, or a hearing aid. These are all extras. The list of preventive services is certainly large, and your primary care provider would know about these preventive services. For example, if you happen to be a woman turning 65, bone mass measurement to measure your density. Some of these are subject to, if you're in a high risk group, then it would be covered as a preventive services. So it's certainly a large list. Okay, so some tips. So the year started and you're getting ready to use your Medicare benefits. First thing you need to look at is, are you paying any more than the $174.70 for your Part B? Or are you paying any extra for your Part D, any surcharge? It's called IRMA. And what happened is Social Security looks at your income from 2 years before, because they don't know what your income in 2024. So they look at it from 2 years before your actually IRS filing from 2022, and they say, you made that much money, therefore it's above the threshold, therefore we're going to give you a surcharge. But 2 years ago you were working and you're no longer working. So if you see that, there are certain things that's called life events. If you have one of those life events, you need to go as soon as possible to Social Security and say, hey, please don't use my income from 2 years ago because my income in 2024 is nothing of the sort. So please adjust my Part B. Social Security is not going to come to you and they're not going to give you money back if you paid it already. So this is something that you proactively have to do. You need to understand your provider financial assistance program. So when people think of financial assistance, they typically think of very low income. That's not the case. There are actually a lot of the provider, whether it's Stanford, whether it's Kaiser, they do have financial assistance that are quite generous, that could pay all or half, for example, of your copays. So it's always important to just ask, what is the limit for these financial assistance programs? If you happen to be on a Medicare Advantage, do get yourself a list of the copay in advance so you are clear in your mind when you go to a hospital with a Medicare Advantage plan, how much you're going to pay. In some plan, they say it's $200 per day for day 1 to day 5. Another would say it's a flat $300 for stay. So be aware of what your copays are ahead of time. Understand your Medigap plan and the copay. So for example, if you have a plan G, then you should expect all you have to pay throughout the year is your $240. So if I see a bill, which I actually did, a bill of $241.50, then a flag goes onto my mind and say, wait a minute, that doesn't make sense because my limit is $240. So I know that they haven't finished really working with the insurance. So be aware and understand of which Medigap policy that you have and what you should be paying. Review your bills carefully and appeal when it's appropriate. And this is something I should say in the beginning of the year. There are some of us that hate to have any outstanding bills. They see a bill, they pay it immediately. So what I'm telling you now, in the beginning of the year, please wait a little bit, because the claims are coming into Medicare, and Medicare is looking at what comes first, and they assign the deductible to it. And if something comes from your provider that was not from the first, and so you end up paying something that you're not supposed to pay, and then you have to reverse everything. So wait a little bit, and you actually will see sometimes in the bill that says the insurance has not gone to your supplementary, or it's just a little footnote. So just wait a little bit, especially in the beginning of the first 2 months of the year, before you jump in and pay the bills. What about the Part D, prescription drugs? So prescription drugs is another area where causes people a lot of confusion. So once you buy a Part D, whether it's part of your Medicare Advantage or whether it's standalone, it works exactly the same way. So what happened is it has phases, 4 phases. And depending which phase you're in, either you pay, your plan pays, your drug manufacturer pay, or Medicare pays. So for example, in phase 1, beginning of the year, a plan might say, you have to pay your cost of medication until you reach our deductible. Now, the deductible that your plan might decide to have could be $0, it could be $200, but they cannot exceed what Medicare set as a limit. No plan could have a deductible more than $545 in 2024. Once you reach that limit, whichever the number happened to be, then you move into phase 2. Now, phase 2 is you pay part and your plan pay parts of it. So if your medication is $100 and they say for this plan, you have to pay the 20%, so you pay $20 and your plan will pay the $80. And you continue like this until what you pay and your plan pay reaches this number. This is not the number that you paid. This is the number you both paid. Reaches that number, then you go into the next phase, which is called the coverage gap. We used to call it the donut hole. Once you get there, you're expected to pay 25%. The plan pay 5%, the manufacturer pays 70%. Again, you stay here until the total amount gets to $8,000. Once you get here, then basically you're done. Your part is zero, and the rest is paid by your plan and Medicare. So when you see an out-of-pocket maximum of $8,000, this is not really what you personally pay. This is what everybody kind of was supposed to pay pays, and it comes out roughly to $3,500 in this year, what you could potentially pay yourself. Last year that was higher because this number was 5%, so this 5% could just go on forever until the end of the year, which quite expensive. Okay, so you have a plan, you understand the different phases. You need to make you go to Medicare.gov and make sure you have a list of your medication copays. You also need to ensure that you go to a preferred pharmacy. So we've seen this a lot. People go to a pharmacy that it's in-network. In-network does not mean it's preferred. And guaranteed is not going to be the same price as preferred. Your plan has preferred pharmacies and negotiate the best prices. So you have to find out which is the preferred pharmacy. So if you decide that you always like to go to CVS and it's in-network, great. But if it's not part of the network and Walgreens is part of the network, you can cross the street and you will get a much better price there. There are some cases where the plan does not cover your medication. They all have a formulary. You could certainly always ask for an exception. So there is actually, every plan has a process where you can file for a formulary exception. There's also a tier exception. Some plans say this medication is tier 4. Some would say is tier 3. And each tier has a different copay. If you think you're in a tier that is medication is too expensive, you could certainly ask for a tier exception. You say, I would like, we would need to do some homework, find what other plans are doing, and build a case, and then go to the plan and say, it would be nice to have a tier exception. There's also discounters when appropriate. There's places like GoodRx, and there are other places where you can go and get the medication outside of Medicare. But be aware, if you do that, this is not going to count toward your maximum official out-of-pocket maximum that is part of Medicare. Okay, so this is a good point to another set of questions for that part.
Yeah, question about when he retired on a particular day, say this February 15th. So he retires today, and his coverage through his employer ends at midnight. How does he make sure that the Medicare coverage kicks in the next day, the midnight on February the 16th, tomorrow?
It is kind of unusual that your coverage would end in the middle of the month. That's actually pretty mean of the plan. So you have the option. Medicare always starts the beginning of the month. So you have the choice either to apply a month in advance. If your employer actually says your medical coverage is ending in the middle of the month, then you have the choice to join Medicare the beginning of that month, so you have no gaps. That's the only way you can really handle it. If they really do go ahead and cover you in the cut you off in the middle of the year of the month.
Okay, got it. And then Susan has I think a two-part question. The first one is Medicare kicks in where it's when you turn 65, or is it at the end of the year when you are 65?
It kicks in the month of your 65th birthday. So if somebody is born March 5th and turned 65 March 5th, then their Medicare would kick in March 1st.
Okay. And then the second part is is there a penalty for this? So say that she is still employed and she has medical coverage for her employer. If she doesn't start her Medicare uh, when she's 65 or older,
Right.
is there going to be a penalty?
Right. So this is exactly the only time where you're exempt from a penalty is if you're employed or your spouse is employed and covered under an employer group insurance plan. So basically, as I mentioned earlier, when you are 70 years old and you want to get Medicare, you go to Social Security and say, I'd like to get Medicare. And they say, you're 70, you're not 65. Where have you been? You say, I was working. They say, okay, take this piece of paper, go to your employer, and the employer certify that you were covered with their plan, employer active plan. Then it goes to Social Security, and Social Security waives any kind of penalty.
Okay, and it's going to be the last question for now. It's about dental and vision. Why isn't Medicare offering dental and vision? And if not, how do I get it?
I wish I could answer that. And if you've been following the politics, I think in the Inflation Reduction Act, there was a very, very strong effort to include dental and vision, and it got killed by Congress. So unfortunately, that's what we are. So the only way to get these extra dental and vision is if you're either a Medigap plan or a Medicare Advantage plan offer them, or you can just go get insurance on your own. I mean, there is no really good answer why they don't cover it. It's just not in the budget.
Great. Okay, back to you.
Okay, so transparency. We encourage people very much not to put things on autopilot, but to really kind of watch what's happening. The first place that is excellent source to go to is www.medicare.gov, gov, not com, not anything else, .gov. And there, if you have an account, and we strongly recommend that you set up an account, then you have all your claims. You can get all information about, like, even if you don't have an account, you can go and say, these are my medications. What should I be paying for that plan that I picked? And it would tell you what the copay should be. So this is the first website that we tell people that they should really use and set up their account, so you can have a lot of visibility about what's going on throughout the year. So the online Medicare.gov, you can look at your claims, you can see how far you are toward your status. You can also see the order of the bills that went in, so you know Dr. X already went through, got his bill, part of his bill was counted against my deductible, therefore I should pay him when that bill comes, as opposed to somebody else where they came afterward that I know that I shouldn't be paying that bill because Medicare eventually will pay it with a Medigap. Now, if you're another source is your provider, whether it's My Health at Stanford or My Health at Sutter. These portals are very important, and you should be aware. And I know for sure that Stanford would post right away. We just want to let you in the loop. This is a bill. And then there will be a tiny little thing that says it's still being processed. So it means that it's pending, but it's not really finalized. So wait a little bit before you actually pay it. Same thing with your Part D or your Medicare Advantage. They also have very good websites that would monitor your copays, so you're not confused about what you have paid already, what you should be paying, have you reached your catastrophic phase or not. So now, as far as if you don't have access to any online services, there are mailing. So if you're part of the original Medicare, every quarter, if you have a service in that quarter, you'll get something called the Medicare Summary Notice. It says in big, this is not a bill. So basically, Medicare wants you to know what's come their way, what's been filed through their way. And you could have cases where you expecting something from a doctor and you see a bill, but you don't see it in your medical notice. So you tell your doctor, hey, please make sure you file a claim with Medicare before you come to me. Also, it's a way for you, Medicare Hope, that you are diligent to look enough to see, hey, I never saw that doctor or I never had that service. So that might be a mistake. Now, if you are with a private company, then you would get like a Medigap or a Part D or Medicare Advantage. You would get something called explanation of benefits. This is not a bill. So basically say we're just giving you a courtesy to let you know what we have paid or paying on your behalf. So this is also something, just spend a little bit of time looking through to make sure that makes a little bit sense. So nothing is very foreign there that you're not expecting. Additional resources if Medicare is not affordable. There are government programs, and the income is typically between 100 to 400% of the federal poverty level. 2024, there are no asset limits. And these are programs like Medi-Cal, programs, Medicare saving programs that pays all or part of your premium and co-pays depending on your income. There is specific Part D coverage that could pay all your copay and your premium, depending on where you are in this limit. If you're in doubt and you need help, contact us and we'll walk you through it. There are, again, I mentioned there's non-government programs. So your provider is your first source. Pharma assistant programs. Pharma gets a lot of abuse because people think, oh, these guys are making a lot of money and charging a lot. And as a goodwill part, they have these assistant programs that are really underused. And they have also foundation to help you with copay that are underused. So if you have an expensive medication, don't hesitate to look through these. Their income limit tend to be much more generous than here. So you don't need to be 400%. You could be higher and you still would qualify for some of these programs. One of the websites that we ourselves use a lot is called needymeds.org. You basically put your medication and then it will tell you, oh, this manufacturer has this is this company and this company has this program. So they aggregate all that information for you. And these are the rules, so you can apply through them or go directly. And as I mentioned earlier, there are these plans, discounters like GoodRx. Okay, so what are the takeaways? The takeaway, understand your coverage. We get people saying, I have Medicare. But again, Medicare, that doesn't tell us anything about what you have. Do you have original Medicare with a supplement, or do you have Medicare Advantage? Huge difference between the two. Don't miss important Medicare dates throughout the year. Birthday rule, take advantage of it. Don't put your plan on autopilot and leave it alone. Open enrollment, special enrollment. Special enrollment, there are some cases where your plan has left. So if your plan left, then you get your special enrollment to, like you have, for example, a Medicare Advantage plan that left. It's not your fault that they left. Then you have a special enrollment. Let's say you moved counties or you moved states, you get a special enrollment. You were in a special enrollment, you were a Kaiser and you moved to a place where they have no Kaiser. Then you get a special enrollment and you get a Medigap guarantee back. So this is one of the triggering events. So understand your benefit and what you should be paying. Take advantage of the assistant program when appropriate. Last but not least, HICAP, how can we help? We offer one-on-one phone or in-person counseling. So we look at your specific needs. We review your plan options with you to make sure you understand them. We highlight the financial assistance programs. We assist with enrollment. If you don't know how to enroll in anything, we will help you with it. We can contact, we have a special special hotline to Medicare that we can actually follow up on issues without you being there. So if we understand what your issue is, we can call on your behalf, and they actually answer the phone immediately, and we can resolve many, many situations. We can assist with your Medicare insurance appeals if you're appealing to Medicare themselves or you're appealing to a private plan. We can aggregate all the information for Medicare per county. So our role is to educate, inform, and advocate on your behalf. Sadly, a lot of people don't know that this is something that is available. So we encourage you to take advantage of it. So with that, I am done. This is the information for HICAP counseling in San Mateo County. If you are in Santa Clara, we have, I think James is going to put in the chat, a number for all the counties where you can look it up. But certainly contact us for whatever issues, and we can definitely try to assist you with whatever you need. Okay, so I have one questions that I wanted to cover before that came from the pre-registration part of it, that basically asked if I have Part B, can I stop it and start it again? Yes, you can stop Part B anytime you want to, but you have to understand why you're stopping it. If you're stopping it because you're working, you're taking a job, that's not a problem. You can stop it, opt out, and go work. And when you stop working, you can opt back in. If you stop it because you don't feel like it, well, if you stop it, then you try to get back again, you could get back, but you would have a penalty. The other question that came across in a couple of cases was about cancer coverage. Well, cancer coverage is absolutely medically necessary, so it's covered whether you have Medicare Advantage or if you have original Medicare. It's medication in general tend to be almost all covered. And part of it is covered under Part B if it's something injected, like an infusion. Part of it is covered under Part D if it's something oral that you have to take. So it's no different than any kind of disease you would have. Let's see. I think that's all I have. If somebody has questions from the chat, I'm happy to answer them.
Yeah. Hey, Maha. So this question is about the open enrollment that is in January to March 31st.
Yes.
So the question is, what if I turn 65 in June?
Okay. So regardless, open enrollment, January to, this is, so when you turn 65, there's something called initial enrollment. So this is nothing to do with any annual thing. This has to do with you turning 65 in a particular year. That could happen any month. So when that happens, you have the right 3 months before and 3 months after to sign up for Medicare. Now, so this is not an open enrollment. This is like, you could think of it as always open because you turn 65. This is your right to sign up. So you could sign up for Medicare any month. I would suggest also, I go into detail in a webinar that we did that is recorded in the library of Stanford. It's called Medicare 101, where I covered all that in a lot more details.
Thank you. And then this other question is about anything like HICAP that's offered in other states besides California, for example, Pennsylvania.
Yes, every state has one of those programs. Now, the national program is called SHIP, State Health Insurance Program. In California, it's just called HICAP, but every state has SHIP counselors. It's actually mandated at one point by Congress that every state has to have people real people that Medicare beneficiary can talk to.
Great. Okay. And before I go to the last question, I'm going to just reiterate to folks online that they could go to the chat to find those links to HICAP. Okay. And then the last question, Maha, is this person wants to first, I think, thank you for presenting all the details that you have given us in such a nice way because it's so complex. So she says, why aren't there simply two choices? You're either in or out. Why do the government bureaucracy, the bureaucrats, make it so complex and burden us with so many complexity?
Well, it's an interesting issue because it's a lot of people attack the government program, and if you really look at original Medicare, it's an excellent program. The issue really here is this controversy in our country about privatization of healthcare. And this is where things get complicated. In general, the American public are against anything that is government. But in this case, the complication comes from this quasi system where you have public system, government system, and you have all these Medicare Advantage, or because people want that. People think they don't want a government program, they want a private. So that's where we find ourselves.
Okay. All right. So thank you, Maha, for sharing all this great information. And thank you to our audience for joining us and for the great questions that you sent in. And if you like additional info or resources, again, the HICAP links are in the chat. So we hope you join us for our next lecture, and good night, everybody.